brain is going to explode with questions and for parents, where we can learn, laugh, and support each other.
We'll be joined by special guests who inspire us and bring different perspectives to the table.
Thanks for joining us.
Have you ever heard of hygge? If you follow Stina and I on Instagram, you'll see that we love hygge. It's one of our favorite things. There is no English word that directly translates from the Danish word hygge. It is often related to coziness during the colder months. However, to us, hygge means creating warmth, love, and togetherness by spending time with the ones you love all year round. We take a quick moment to tell you about our latest project, the Hygge Family Box. It's a curated selection of our favorite local gifts aimed to bring families together and delivered right to you. Our mission is to bring families together and create presentness by being in the moment with the people you care about. This is what hygge is all about. It is a Danish word that means coziness, warmth, and togetherness. Every item in our hygge family box has been carefully selected by Lisa from Giving Gifts and Stina and Bree from the Mindful Mummies. They are all beautiful gifts that we use in our homes and with our own families to create a warm and inviting environment filled with special, meaningful moments. Our seasonal family box will help you effortlessly spend quality time with your loved ones while learning and trying new things together along the way. So grab your family, open the Hygge Family Box, and let's get hyggely! For more information on the Hygge Family Box, you can follow us on Instagram at the Hygge Family Box or visit our website at themindfulmummies.com.
Welcome to the Mindful Mummies podcast. Today we are super excited because we are going to be discussing one of our most popular and most downloaded episodes again, birth. And I've invited Dr. Carley Akehurst to come join us and give a little expert advice and opinions on this topic that was such a popular topic in the past. So today we are super excited to welcome Dr. Carley Akehurst. Dr. Carley Akehurst works hard to provide compassionate, comprehensive, and evidence-based care for her patients. She was first introduced to complementary and alternative medicine through several international study programs. After completing her bachelor's degree at UC, she expanded her knowledge of the medical field by working with both NDs for choosing a career in naturopathic medicine. Dr. Carley Akehurst at Naturopathic Medical School at the Boucher Institute of Naturopathic Medicine. Dr. A in the treat and prevent chronic disease, immune dysfunction, allergies, gastrointestinal disorders, hormones, and stress and fatigue. She has a strong passion for family medicine, especially for pregnant women's health and children's health. During her training, Dr. Carley completed a as a doula, childbirth educator, and consultant. She was supporting Lower Mainland since 2000 at home and house. Most recently, has been a eater, a book about and the plays in children. She has consulted microbiome, encouraging time her husband and a raiser, doctors in preventive health at Broadway and BC.
Welcome to the podcast.
Thank you.
So now, let's go to Me, there was absolutely no question about it and for my husband that we wanted to be in a hospital, but who knows? Maybe after this podcast, I might change my mind. We'll see by the end.
Yeah.
Not that I'm having any more children.
Yeah, I was like,
forget it. No more kids for me. But I might be a little more open-minded to it.
Yeah. So I'm curious, as far as, did you become a doula first or a naturopath first? What was the...
Yeah, great question. So I became a doula while I was studying naturopathic medicine. So for the first 2 years of naturopathic school, it's primarily classroom work. And then for the second 2 years, we do much more clinical work. So when I started in third year with my class on obstetrics, I immediately found my passion and pretty much right away signed up for a doula training course and started to attend births. I've known for a long time.
Were you a mom at the time or no?
No,
you
not
weren't.
yet.
Yeah, okay.
Yeah, not yet. So that was about 2009 that I had done that. I'd known for a long time that I was curious about birth and initially debated going to midwifery school or naturopathic school, but naturopathic school seemed a bit better fit at the time. And then I attended births all through my training and even after I had my first child.
Wow. So do you still attend births now?
Not at the moment.
No.
The schedule is just too hard to be on call, have a busy practice, and have 3 little kids.
Sure.
But I look forward to getting back to it at some point in my career.
Yeah. So when you work with people in your practice, do you work primarily with moms that are pregnant or?
So I provide a wide. Sorry.
That's okay. No, go ahead.
I provide a wide range of care in women's health. So I do see a lot of patients who are pregnant or wanting to get pregnant. I have lots of patients who come to me partway through their pregnancy to help prepare for labor and delivery. And then a large part of my practice is working with postpartum women. So helping women recover from labor and delivery, recover from pregnancy, and sort of live happy and vibrant lives.
Which we all need and could use for sure. Because talk about a whirlwind. I mean, I know for me, after giving birth, it was just like, it was traumatizing. Like, I remember just being like, what just happened? I can't believe that just happened.
Yeah.
So that's wonderful that you're doing that. There's such a need, I think, out there. And I feel like there's so much care for the baby and how the baby's doing, but you don't hear too much about taking care of the mom and what the mom needs. And that's amazing. Yeah.
So I had my first birth was in the hospital, and like Bree said, I would have used the word traumatic to describe it. Mm-hmm. And it was actually like fairly okay. I wanted to have no drugs, and I was able to do it without drugs. And I didn't end up having to have a C-section. Everything was fine. But I was shocked because it just wasn't what I expected. And then
it never is.
No, it never is. And that and then I had a friend that didn't tell anyone she was going to have a home birth and then had a home birth. And afterwards was like, surprise, I had him at home. And we were all like, what? And it sort of made me start thinking, being like, oh, maybe I could do that. Like, she did it. Maybe I can do it. And then I was like, I really want to have a positive experience. I don't want to have to say that it was traumatic. I want to say it was beautiful and wonderful. And so that was what inspired my second and third being born at home. And they were for me, it was a much more positive experience. And I was very lucky to have very uncomplicated labors and deliveries for those two. So what about you? I know you said you've had 2 home births and 1 non-home birth. Do you want to tell us a little bit about your story and what led you to deciding to have a home birth?
Absolutely. So as I mentioned before, I've been passionate about birth for a long time. And I spent a lot of time thinking after attending births myself about what I would like to have I really did want to have my first baby at home, but complications meant that was not a safe option. So with the advice of my care providers and long discussions with lots of different people and research on my own, I determined that being in the hospital was the safest place for me. And I would similarly describe my first birth as generally a positive one, but it just wasn't where I wanted to be. I was pretty happy with my ability to voice what I wanted, which took a lot of strength and a lot of courage. And I think there's no real amount of preparation that can prepare you really for quite what that experience is like. I've just seen it time and time again, right? You never know what's going to come up. And so for me, it was really finding my voice and feeling empowered in expressing what was important to me and being able to seek truly informed consent from my care providers that ultimately led that to be, I can say it was a beautiful experience, even though it wasn't really what I had hoped for. Mm-hmm. So when it came time when I was pregnant with my second, one thing that was really important to me was to try to have the baby at home, if possible. And I have a few reasons for that. It was just where I wanted to be, but I think this is a good point to talk about feeling safe. So there can be a lot of controversy in the birth world about home versus hospital, but ultimately I think encouraging a patient or a woman to find the place where she feels most safe is the most important. And that was different for me in my first and my second and third births. In my first birth, the situation was such that I felt most safe at the hospital. So for me personally, I really find, and I talk about this a lot in my practice, that a really important part of choosing where to birth is thinking about where you feel safe. Mm-hmm. So there can be a lot of controversy or a lot of righteousness around home versus hospital birth. But really, ultimately, I encourage patients to find the place where they feel most safe. Mm-hmm. So for me, that was different in my first birth. My medical history and what was going on at the time meant that I felt safest in the hospital, even though that's not where my heart wanted to be. But for my second and third birth, I felt most safe after, researching a lot. I felt most safe at home. Mm-hmm,
mm-hmm, mm-hmm. It's so interesting you say that, because in my first birth, I remember so vividly the midwife telling me, she was like, every time we would go to the hospital, because my water broke for like 3 days, and I didn't go into labor. So we had to go into the hospital to get non-stress tests and checking on the baby. Every time we'd go, I would have contractions show up on the monitor. And then I'd go home and feel nothing. And so the midwife was like, I wonder if you just feel safer at the hospital, because every time we would go to the hospital, I would start to feel like I was having contractions, and then I would go home and it would be nothing. And I think because it was my first and I was so unsure about everything, and because my water had been broken and there was concerns about that, I just felt safer at the hospital. Where with my second one, I was like totally happy to be at home, contractions, no problem, like everything, went at home.
Yeah, and I had, for my first labor, it was pretty traumatic, and I had a pretty, it was an emergency for sure. I lost a lot of blood, and it went from everything's fine to, well, we've all heard the story of 20 people rushing in the room and alarms going off everywhere. That was me. And so for my second, it was just, there was just no question, especially to my husband. I mean, he was the one that witnessed everything. I had an epidural with my first and was sort of, I was there and fine, but I was probably not as anxious as he was, seeing everything that was going on. And in his eyes, it was just like, no way. There's absolutely no question that we will not be in the hospital in case that happens again. Yeah. And that's the thing, I think back, for me, I think back to, and I want to get back to your story, Carly. I'm sorry, we're interrupting with our own, but
it's all good.
I think back to that first experience, and I think, what would have happened if I wasn't in the hospital? Where would I be at right now? Where would my baby be at would we be safe? Would we have made it? And because it was really, really bad. It was really scary. So anyways, that's just a different perspective, but yeah.
Yeah.
I think it's really important, though, to talk about that and to look at safety and every single birthing person's experience and risk factors and supports are going to be different. So, if you are a single mom without a secure space to birth at home where you feel comfortable and safe, you can't afford a doula, that would be a very different circumstance than somebody who lives in a really large house across from BC Women's Hospital, right? Mm-hmm. So I think it's important to recognize when we're talking about home birth versus hospital birth that we really don't know a person's medical history. We don't know their socioeconomic history. And a lot of, I think, judgments around home or hospital birth come with a lot of assumptions about that, right? Mm-hmm. And so I think it's really important to just acknowledge that, everybody's different, and what feels safe to one person would feel totally safe to somebody else, or totally unsafe to somebody else. After my first daughter was born in hospital, and she was born by cesarean, so I had my best friend had a baby a year later, and she wanted to have a primary scheduled cesarean because that's what she wanted. And she really struggled to understand why I was upset that I hadn't had a home birth. And one of the things that I said to her that I think finally helped her to realize is, imagine you were being forced to birth in a place you didn't want to, right? So I think that's important to recognize that what is safe and comfortable and ideal for one person could be completely different for somebody else.
Totally.
So I think that probably brings us to a good point where we should start to maybe talk about some of the pros and cons of hospital birth versus home birth. Maybe you could run us through just that.
Yeah. So the biggest difference that I find most patients or most women or birthing people think about is access to pain medication. Yeah. So in the UK, there is an option to have nitrous oxide, the laughing gas, delivered to your home before you actually plan a home birth. That currently isn't an option in BC. So if you are planning to birth at home, you would be looking at non-pharmaceutical pain medication options. So meditation, breathing, TENS machine, using water, that kind of thing. So that's a primary difference. Whereas in hospital, you would have access to all kinds of anesthetic and pain management options. Do you have any questions about that? Often I get questions about...
Have you heard of hypnobirthing?
Say that again. Hypnobirthing.
Yeah. Okay, so with my first, I was going to hypnobirth that baby out. I was just pain. There was going to be no pain. I was going to hypnobirth. I had affirmations recorded of my own voice, and I was sitting there listening in like early labor with like the first, like when my water had broken and it wasn't an active labor, listening to my affirmations and my like yoga pose on my yoga ball. And then the second active labor started. I was like, get this thing over me! Like chucked my iPod and my headphones at my husband and was just like animalistic, like, rawr, like that's what I needed to do in that moment. But it was so funny because the second birth, and obviously like subsequent births can sometimes be easier, and that was my case. I don't know if it's just because you're mentally prepared or your body's prepared or they're faster, but my second birth, I went back to the hypnobirthing, even though the first time it totally failed. And I was like, okay, I think part of it was that I understood what was going to happen. I knew what was going to happen, and so I was prepared for it. And so when the like waves of contractions started, I was actually able to use my affirmations better.
And there's a sense of panic with the first because you don't know where this is going to go, and you think, is it going to get worse than this? Because if it gets worse, I'm going to die. I can't take this, you know? With the second, you go, it gets really bad, but I don't die. Yeah. It gets really, really bad and really uncomfortable, but I don't die. Yeah.
Did you use a TENS machine ever? I've rented it, but never used it.
I did. So I used a TENS in my second and my third birth, and I was holding on to that thing for dear life.
Wow. So you found it really helpful.
I did. So I ended up, I had a water birth with my second, so I didn't use it in the tub, but I used it really quite a bit in early labor. And then in transition, when my mean midwife made me get out of the tub and really suffer through it.
Yeah.
Don't get me wrong. I love my midwives. They're absolute angels on earth, but
she knew what you needed to do.
She knew what I needed to do, even though I didn't want to do it.
Yeah. I think my midwife, she was like, okay, you need to decide now. Are you going to give birth in the bathtub or are you going to get out? And I was like, I think I just peed in the bathtub, so let's get out. And she was like, oh, it's fine. You can still give birth. And I was like, no, I don't know. Let's get out. And then the second I got out, it was like, boom, go time.
Right.
Yeah.
That go time for sure. It can be tough, right? It can be really tough.
Carley, I was so interested in the stats that you added to our notes in preparation for this podcast. I actually thought that it would be much higher for how many people have home births.
Yeah, it's quite interesting. So 3.5% of births in BC are home births. A further 22% of all births in BC are attended by midwives. So that kind of gives us a good snapshot in terms of how many people are birthing at home, and that number is definitely increasing. One of the biggest questions that I get
low to me, though. Yeah.
One of the biggest questions that I get about home birth is safety. So there's a lot of concern around safety. What we find time and time again from the studies is that the risks of complications for moms and babies are the same at home and in hospital for low risk pregnancies.
Right.
So the key is low risk. So in terms of outcomes, they are pretty much the same for home and hospital. But the other key to that is having a licensed midwife and that's regulated. So in BC, we're really lucky. The College of Midwives of BC regulates midwives. They have extensive training in home birth and in managing home birth emergencies. I remember when my second was born, I was surprised at just how much equipment they brought with them. But they bring all kinds of things that are that involve supporting the baby after birth, supporting mom during the birth or after if complications arise. So they bring all those medications and the emergency equipment as well.
Yeah, they took over our entire kitchen and dining room table, and it was like so much stuff. Yeah.
What about multiples? Just quickly, I know we're.
Really good question. Yeah. So multiples are still classified as higher risk pregnancies. So there are stories of home birth multiples, but again, that's a decision that's probably best made with an individual's care provider because their health history, would play a really important role. What position are the babies in? How old is the mom? How many weeks pregnant is she? All of those types of things all play a role in making a decision whether home birth is safe.
Right. Okay.
Awesome. Thank you. Yeah.
So back to hospital birth. So for me, because I'm the hospital birth girl, even though you both of that, I like to claim that one. No, I'm just kidding. That was pretty inevitable for me that I wanted to know that if need be, the first one, I think I always kind of knew in the back of my mind that I probably would get the epidural, even though I went in wanting to try. But I wanted to know it was there. I wanted to know it was there just in case. And with the second one, I never had time to get an epidural, which was a shock. But it was still nice and comforting to know it was there too, if need be. So even though it wasn't actually, because they couldn't do it in time. So it doesn't always, it's not always up like a definite that you're going to get the epidural. So.
Yeah. Absolutely not. Yeah. And again, I think it's hard to know when you're having your first baby what you will want and what it's like, right? And so for many women having that, it's kind of like insurance, right? Knowing that the anesthesiologist is down the hall and it's an option if you need it, right? I think it's important to consider that.
Yeah. So is that really what you would say? There's definitely other things. Yeah,
so
because I'm gonna there's nurses and doctors and, emergency team and
Absolutely. Pain medication is not the only difference. And it's important to recognize that, sometimes even if you plan a home birth, it won't necessarily mean that you're guaranteed to be having your baby at home. Mm-hmm. So one thing to consider is that at the hospital, when you're admitted, you're at the hospital. So your baby will be born there, mm-hmm. right? If you are laboring at home, there may be a reason that you have to transfer in your labor. And so I've been on many transfers to the hospital, and that can be really hard for laboring women. It usually happens by private car. Occasionally, in certain circumstances, it happens by ambulance. So a woman would go from her home to the hospital in an ambulance if it was really an emergency. But that can be challenging, too, to change your place of birth.
I can't imagine having to do that. Like, you're right in transition, and you're having to switch over to, oh my God, like, no way, I couldn't. Yeah. That was a big one for me too. Like, when I really started to think, especially with my second, how much pain you're in, and then to now have to get into a car and transfer yourself. Oh my God. Yeah.
And one of the midwives that I work with and really respect, I love what she commonly says. It's safe to have a baby at home, and we can talk about that in a sec too, but it's safe to have a baby at home. It's safe to have a baby in the hospital. It's not really that safe to have a baby in the car.
Oh my gosh. Is that my midwife? Because I've heard that so many times too.
Yeah, I'm sure they've learned that over time.
Yeah. When I'm always like, I was always like, oh, no, I can't decide what if I want to be in the hospital, I want to be at home. My third one, I was like, oh, it was just so messy, the second one having it at home. I kind of just don't want to deal with the mess.
Yeah.
Well, and there's that too, right? Yeah. Like, that's important to talk about as well.
Yeah.
I think when, in my experience, having a birth, birthing my son in the birthing pool, mm-hmm. that was less messy, but my daughter was born on our bed, and that definitely was not quite as simple cleanup, I would say. Luckily, I was in the shower at that point, so I didn't notice it, but it was something that my partner and doula and midwives had to be on board with.
Yeah. It was quite a bit of, and just preparation. Like, you have to be very prepared with all.
You have to be prepared.
All the different materials and things. And
okay, back to the hospital.
Yeah.
So I'm keeping you on track.
Thank you. You're good at that.
The other aspect is having access to other healthcare providers. So commonly, midwives and family doctors are licensed to provide home birth services in BC, but in urban areas like Vancouver, it's primarily midwives. I could be wrong, but I don't know of any family doctors that are doing home births at the moment. And so if you need access to specialist care, so you will be referred at any point in your pregnancy with midwife, or if in labor something comes up where you need specialist care. And midwives are often in constant communication with the hospital. So if they need to consult with an obstetrician or another type of professional, they can do so over the phone. But that doesn't necessarily mean that you would have a consult with the obstetrician if something came up as a complication in your labor. Mm-hmm. There's also a difference here between urban and rural centers, right? Mm-hmm. So choosing to birth, like I said, across the street from Women's or St. Paul's Hospital is different than if you live 2 or 3 hours away from a hospital that has an anesthesia team and access to a 24-hour operating room if that comes up. Mm-hmm. So that's another piece, and it's highly personal because it depends on your own medical history and as your pregnancy history, but also if there's any complications that have come up. So it really is a discussion, an important discussion to have with your healthcare team to see if you are, at any elevated risk and how quickly you would need that consultation with another healthcare professional. Mm-hmm. At home, it's harder to get that.
Mm-hmm. Mm-hmm. With my experiences, I throughout my pregnancy, I saw midwives, and my midwives were at the hospital. So that was kind of, I was sort of, I don't know, I guess the middle ground. Like, it wasn't a home birth, but I had my midwives with me the whole time. And my experience with my midwives were wonderful. All the way leading up, I just loved the care that they provided me. And then the aftercare as well was amazing too. Mm-hmm. However, with my first, there was a point where the midwife had to completely back away and let the obstetrician take over. and I could see the fear in her eyes, like and so and still that's very clear in my memory, which which was part of obviously my decision for my second to be in the hospital. But once again, I was sure glad that there was an obstetrician there to take over and take the reins when things got totally out of control.
Yeah. And that's really important to think about, because many times birth is unpredictable. Mm-hmm. Often really well-trained midwives, and in BC, we are so fortunate to have access to midwifery care that is covered, that provides that perinatal care. It's amazing. We are so lucky. And that might not be the case for your listeners that are not located in BC, because midwifery regulations are different across provinces and in different countries. But often well-trained midwives are looking for concerns at home. So you do have the same monitoring, the same temperature, blood pressure, fetal monitoring usually is intermittent. So that means that they would have the Doppler on and off your belly, but listening to the baby's heart rate. Mm-hmm. Sometimes things are unpredictable in birth, but more often than not, a well-trained midwife is looking out for that and would have you transfer prior to an emergency. Mm-hmm. That doesn't necessarily mean that happens all the time. Mm-hmm. But like I said, we're really lucky to have excellent midwifery care here. Mm-hmm. For some women, though, being at the hospital and knowing that the obstetrician is there and can be there in a matter of seconds is really important to them. Mm-hmm. And again, it's such a personal decision in terms of what feels safe and what feels comfortable to you.
Mm-hmm. Mm-hmm. Well, and that's exactly it. It was all fine until it was literally a matter of seconds, and then things just started to head south, and it was fast. It went south really, really fast. Mm-hmm. So anyway, and I've been at births like that, and it can be very scary. It can be traumatic for a birthing person, but also for her partner, right? Yeah. And so those are important things to consider. One thing I think that's really challenging about our current society is that we don't really talk about birth in this way, which is really important to the job that you're doing to bring it to light and to talk about it, because I think women need to know that it is unpredictable, and it's important that we make educated, informed decisions that help us to feel empowered to make decisions that are relevant for ourselves. Mm-hmm. Totally. And I always joke with my mom, and I say, Mom, how come you never told me how hard this was? How come you never told me? And she says, well, honey, if I told you, you probably wouldn't have any children, would you? And she's like, and what good would it do to tell you how traumatic it is? Yeah. And my mom has the same experience. I mean, and I shouldn't say, I mean, not all, and really not all births are traumatic. And usually second and third births actually go pretty smoothly. It's the first that I think can be quite traumatic for a lot of people. Am I right about that, Carley? Or
it really depends. So it really depends. And I've been to births where the first and second births have been really straightforward, and then a third birth is traumatic. And again, I think it comes back to looking at each birth as an individual thing, and you may change your mind. I know of several women who had home births originally, or for their first or second births, and then for a third or subsequent birth chose to be in hospital because they just felt like that's where they felt safest, or they had a harder pregnancy, or that's just what they wanted to choose. And so I think it's important to treat every birth as an individual experience. For me, I've had 3 kids in 5 years, and I can say that even though you could classify my births as hospital and home, they were all 3 incredibly different. And after my second birth, I remember it had been what felt like 10 minutes afterwards, and I said to my midwife, when can I do that again? Yeah. And I loved it. Yeah. And after my third birth, I looked at my midwife and I said, I'm good.
Yeah. Never again. Yeah.
I'm good. I'm done. I'm good. Yeah. This baby will be our last. Yeah. And so I think that, it's so easy to look at things on the surface, but really, in my experience, what helps women to feel positive about their birth experiences is that they feel informed and like they were able to make educated decisions, because there's no way we can predict what's going to happen in birth. But if you feel like you have the knowledge, you and your partner have the knowledge to make those decisions that feel right to you, that to me seems incredibly important in terms of a woman's birth experience.
Yeah, I've been hearing Bree's story with her first. I was we were living together yet, but I was like got to hear all the details, and that was constantly in my brain when I was deciding with my second whether or not to have it at home or in the hospital. And so we actually talked to the midwife so many times, and we're going back and forth, and I didn't even decide until the very end. And even at that point, the midwives knew. They were like still checking with me. Okay, do you want to stay home or do you want to go to the hospital? Because they knew that I wasn't sure. And they were just there providing me with information and helping me feel safe. And like I could call them at any time and ask questions. And my husband would call and ask questions all the time. And we would take up our full hour appointment with them with all of our questions. And in the end, you said, it's funny because you were like, I looked at my midwife and said, when can I do it again? When we had our first home birth, our second baby in the water, in the tub, he came up and I lifted him up between my husband and I. He was outside of the pool and I was in the pool, and he burst into tears and was like, when can we do this again? And he just loved it too. I wasn't quite there yet.
Yeah.
But then my third, I wasn't sure. I was like back and forth again. I was like, I don't know. I'm not positive. And I always was never sure. But then once I was in it and I was at home, I was like, no, I don't want to leave. I feel safe. I feel in the zone. I know we've got this. And my third was like the simplest birth ever. Yeah. I don't even think I screamed. I was able to use all my techniques and hypnobirthing and it was just beautiful. Yeah.
Amazing.
Yeah, it's so interesting.
I think like again, talking about how things aren't black and white, it's important to acknowledge, I think it's important to acknowledge that it's possible to have that home birth experience in the hospital, right? Mm-hmm. So if what it is that's really important to you is to feel it's safe in your space and have privacy and lack of access to or you don't want medications, you don't want to be asked about medications, autonomy is a really important thing. So we do have autonomy over our own bodies. We can decline interventions, and having those conversations with your care provider and with your partner as well are really, really important. Mm-hmm. And for our local hospitals here in Vancouver, we're really fortunate to have, most of the birthing suites have bathtubs, so you can bring in electric candles, you can play your music, you can do all of those types of things.
Yeah,
exactly. And so even with my first birth with my daughter, who was born in 2015, I had to see an obstetrician because I needed a cesarean for various complications, but I felt like I was almost able to have that really personal experience in the hospital. We dropped the drape when she was born. I got to see that. She was lifted up and over the drape and onto my chest right away. My husband cut the cord. She was born to Van Morrison's Sweet Thing. So I think it's really possible to advocate for yourself if those are the things that are important to you. And that's really what helped me to feel positive. I didn't initially feel positive about my first birth because, like I said, it wasn't what I had really hoped for or envisioned. Mm-hmm. But when I look back now, 5 years later, and I look at the photos of her birth, I am so proud that I found the strength to do that, and that I was able to have an experience that I can look back and ultimately see was really beautiful. Mm-hmm. So I think that, working hard to create that environment that you want to have is wherever you birth is really important, right? Mm-hmm. And it's possible. Yes. That's not to say that everybody that has, you mentioned something about this before, and I think it's another important thing to think about. Not everybody that has a hospital birth has trauma. Yeah. Not everybody that has a home birth is saved or without trauma. Mm-hmm. And as I mentioned before, birth is so unpredictable that sometimes there's circumstances where you just can't prepare and you can't create that environment. And it's important to acknowledge that and honor that as well, because that's really important when talking about birth.
Mm-hmm. Yeah.
Now, what would you say some people would say are some negatives about giving birth in the hospital? Because I think that's important. And I don't know if negative is the right word to use, but some maybe
some challenges.
Thank you. Yeah. Challenges.
Yeah, some challenges. So one thing that I was really nervous about prior to my hospital birth was privacy. Mm-hmm. So privacy was really important to me, and it's a little bit harder to navigate that in the hospital because there's regulations around how frequently you should have your temperature checked, how you should have your blood pressure checked, and then even staying in the hospital through the night, having checks as well. And some of those are important for medical reasons, but as you mentioned, sort of with your first birth and having 20 people in the room all of a sudden, I was really anxious about that. And there are circumstances where that's necessary, certainly. But that was one thing that I was a deciding factor for me in having a home birth, was that I wanted a select few people to be there if possible, right? Mm-hmm. So the other thing too is that, as you mentioned with midwifery care, it's phenomenal because you will generally know what midwife is attending your birth. But if you don't have access to midwifery care, or you have another care provider, you won't necessarily be guaranteed to have your own care provider that's been providing care throughout your pregnancy be present at your birth. So you might have somebody that you had never met before. And for some women, that can be really unsettling.
Mm-hmm. Mm-hmm. Yeah. Yeah. Yeah, I loved that with the midwives, we got to know 4 of them, and you knew that one of them, it would be someone you knew who was at your birth.
Mm-hmm. And I also, for me, it was also, I don't know, just important that it was a woman. That's what was comfortable for me, that it was a woman there looking at my,
Yeah, and with the, I think it is
my inside.
Yes.
For many women.
Yeah.
And especially with like the Me Too movement and understanding sexual abuse, like a lot of women have a history of sexual abuse that isn't necessarily talked about or known. And so again, like having multiple people in a room while you're in a vulnerable state can be really triggering. Mm-hmm. So yeah, I think it's important to consider all of that when you're thinking about where you feel safe. Do you feel safe having a number of medical professionals nearby and in the room? And that might be the case for some women, but for some other women, that might not be.
Mm-hmm. Mm-hmm. So you mentioned you had a water birth with your second one at home. Can you tell us a little bit about how you came to the decision to have your home birth after having C-section, and also how you chose to do water?
Yes, great question. And I love chatting about this because I can tell you I spent hours and hours and hours researching this.
Yes.
And looking at safety statistics and really considering our own personal situation. So for my own circumstances, I relied heavily on evidence-based birth. I don't know if you know about them, that they compile a lot of resources in terms of...
No, I haven't heard that. Evidence-based births? Okay.
Evidence-based birth, yeah. So Rebecca Decker is a nurse who puts all of this information together. She actually just came to BC and gave a chat in February, which after spending years following her, felt like meeting a true celebrity. Yeah. I was such a nerd about it. But so she provides a lot of really good information in terms of hard data around common interventions. So epidurals, induction, VBAC, looking at safety data and ways to sort of prepare yourself for that. So after reading all of the data, my care team, my partner, and I made the decision that we wanted to be at home and that we were comfortable with that risk level. I should also mention that we live quite close to BC Women's Hospital, so we're within a 5-minute drive.
Yeah.
So that helps, the confidence. So once we made the decision that we were going to try to have my second at home, we hired a doula, the same doula that we'd had for my first and I had for all of my births. She's very experienced, and that was a really important component to me to help support me mentally through that decision and through the birth process at home. I should also mention that my son was born at 42 weeks, so he waited until the very end to make his appearance.
Oh, my goodness.
Which was also a challenge mentally, right? stay committed to that. And as you mentioned, going with non-stress tests and just riding through that. But again, like I went back to the evidence and what I felt most comfortable with. And we made that decision as with my care team and my husband as well. And so with our doula, her practice is to set up a birth pool. I knew, like, I love to have baths, I guess. So I knew that probably would be a good comfort measure for me.
Yeah.
So she and my husband set up the birth pool in our very tiny living room.
Yeah.
And I could have stayed there. I probably would still be pregnant with him if I had just stayed in the birth pool.
Yeah.
It was a really good coping mechanism for me. And so he was born in the daytime. So the light was streaming through the windows. There was nice warm water. And I just kind of hung out and floated through the contractions.
Nice.
Now, having had my third and having had different birth experiences, I don't want it was a really good, a lovely experience. My third was not like that, but for him, it was a really nice coping mechanism until my midwife and doula determined that I was too comfortable and sleeping in between contractions was not an effective way to get a baby out. So amazing. They got me out of bed and we tried a few other positions to sort of get things really going, and that pushed me into transition, which was really tough. And then I got back into the birth pool. At one point, I remember saying to my husband, like, "Are you going to get in?"
Yeah.
That was a hard no.
Yeah. I don't know about that.
That was a hard no.
I've seen videos of births where the husband's in the pool with them. Yeah. He was good with just sitting real close. Yeah.
So he was born, I was on my hands and knees and then lifted him slowly up through the water. And it's like no other, right? Like I think when you have a baby, and not everybody has that experience, it's a mix of shell shock and wonder and awe and love. But it was it was a really cool experience for me to have him in the water, especially because it had been such a hard experience for me. I wasn't sure I was ever going to have that after having thought about it for a long time. Mm-hmm, so I did a lot of work after my first birth to come to terms with how she was born. And it was a really wonderful thing.
That's fantastic. Yeah. And talk about giving hope to people who, have gone through cesareans and really want that home birth or that natural birth experience too. It's beautiful that you were able to make that happen. It's wonderful.
Thanks. And not every woman that'll try for VBAC will get to have one. And I think, especially given the privilege that I have of working with women, both in my profession and in my work as a doula, I know that, and I know that full well. It's not guaranteed. And so I think it's important to acknowledge that too, that there's often grief there, right?
Absolutely,
when, there's a really cool book that I came to after my first, and a really neat Facebook group called Home Birth Cesarean. And it's a really supportive group for women who desired a home birth but ended up having a cesarean in hospital.
Oh, okay.
It's a Facebook group?
There's a Facebook group and there's a book. There's actually a workbook.
Oh,
and that was really helpful for me to identify with other women who had desired to have a home birth, but couldn't. And really, I see it that I transferred at 28 weeks when when my complications arose, right? So it doesn't matter if that transfer happened or, you had been desiring a home birth and you have a baby in a difficult position and you have to abandon that plan and, be in the hospital where that's not necessarily where you feel safest. It's important to acknowledge that grief. And we have a lot of amazing grief counselors located here in Vancouver and throughout the province, and specifically that work with women who have trauma or grief around their birth experience.
Mm-hmm. Yeah, it's so important.
I'm starting to think that I maybe should have had some of that trauma, that I should have had some counseling about or maybe my husband. One of us, either of us, both of us.
Yeah.
I feel like, I think that I was for sure traumatized. I think he was even more traumatized. But yeah, I think it's absolutely necessary for many women. Yeah.
I know my mom, like, even to this day, she still has some grief around her birth experiences. And the first me, I didn't go the way she had it planned at all. Yeah. But the second, my brother, she ended up having a midwife present, even though she had a C-section, but she had a midwife. And that was, 36 years ago. So she had to fight really hard to have her midwife
to have that
with her. Yeah.
And it's important, like, it's not too late. We carry our birth experiences with us, as you say, like our, moms carry that birth experience for a long time. Yeah. And it's never too late, whether you had a birth a month ago, a year ago, 10 years ago, 30 years ago, whatever. It really is not too late to come back to it and process that and honor the person that you were at that time, honor the grief, honor the trauma, and work through it so that you can come to a place where you can see the strength that it required to bring that baby here and how incredible that strength is, regardless of what that looked like or whether you were at home or in the hospital or in the OR or whether your baby didn't come home, right? So the strength that it requires to go through that is, it's like no other, right?
It's interesting because, and I want to say this right because I don't want to offend anyone, but for me, I have to say I was one of those people that I didn't quite understand the attachment to having these, like, they have to be vaginal births, I've always just looked at women as warriors no matter what, and the fact that they can carry this create this baby inside of them for 9-10 months and then bring it into the world. Like, to me, I can try to understand it, but I have a hard time understanding the attachment to it. Not that I don't have empathy for it. And to me, if I had to have a cesarean, I would still be proud of myself and still acknowledge what a feat that was, So
yeah,
I think it's important maybe for people who maybe you can give us a little insight in on that, because I'm sure there's lots of people out there that don't understand it too. And then for the people that are going through it, how to understand it,
Yeah. And thank you for bringing that up, because I think it is really important. And it's something that I experienced. Like, I really struggled with having to have a cesarean. I'm a naturopathic doctor. I'm a doula. I've been thinking for years about what my home birth would look like, right? Yeah. I never doubted that I could endure the pain or I was excited for labor and excited to birth my baby and experience what that really felt like. What the interesting thing to me was that I initially, after having had her, my daughter, by cesarean, I was really proud. And the whole day I kept saying to myself, I'm so brave, I'm so brave, I'm so brave. And I really, truly in my soul feel that.
Oh my gosh. People who go in for cesareans, I mean, I think you are so brave. That's exactly the first thing I think is, I can't imagine having to have somebody take me into surgery.
Terrified of having a cesarean. Yeah.
No matter what, it's hard. No matter what, it's not easy.
Totally.
Yeah.
Totally. And I think the thing that was really challenging was, as I went on and more people learned that I had a cesarean, it was other people's judgment that I allowed to cloud my own experience. And so looking back, like, we had a doula and our midwife was there, and she took photos for us of my daughter's birth, so of my cesarean. And looking back at the photos, like, I'm in awe of my strength. That took way more strength than my home birth. But what I noticed is that people applauded me for my home birth and judged me for my cesarean.
Wow. So why is that? What?
Yeah, I heard a lot of, how would you really know what it's like to be a mom? You haven't really given birth yet.
No.
Shame.
People said that to you?
That's horrible.
Someone in my family said that to me. And so it's really hard. And you hear this from women who had a cesarean, that there's a lot of judgment and a lot of shame out there. And I think it applies to women who have interventions in hospital births as well. And I am sure that there are judgments around home birth, but in my experience, I was really applauded and praised for or celebrated for having a home birth. Whereas the real struggle to me was to be in a hospital where I didn't want to be. But that was it. I realized over time, it took me a long time to figure out what was happening and why I'd sort of developed this insecurity around having a cesarean. And I realized that a lot of it was outward judgment.
Yeah.
Caring what other people think of you.
Yeah. And when I let that go, I was allowed to see, and through lots of counseling and lots of work and 2 subsequent births, but when I let that go, I was allowed to, it gave me the space to really recognize how incredible it was that I was able to say, no, my baby is my priority. This is where we need to be for safety. Like my desired birth experience comes second. And that to me is pure love, right?
Yeah.
Absolutely. Oh, I just can't believe somebody would say that to you. I just can't believe it. I mean, how do you know what it's like to be a mom if you haven't given a natural birth? It's like, what about all those months a vaginal birth. What about all those months that you carried that baby and felt that baby kick inside of you and nourished that baby with healthy food and vitamins, and I mean, forget
and
those
then
people.
I chose the
forget those people.
It's interesting, but I think that's also part of like why it's so important that you both are doing the good work that you're doing, because I think that we come across these circumstances in motherhood and it's so unfortunate, and really like we should be working together, but that's not always the case. And I think it's changing, but not fast enough.
Yeah, we need to support each other for sure.
Yeah.
100%.
Wow. So many feelings come up when you start to like think about all your previous births and listening to your story. I'm getting goosebumps.
It's such an emotional experience and time in your life, and I think that that's why it's so important to get that aftercare as a mom, because when you think about what you have gone through, as far as carrying the baby, giving birth, now raising this little being that comes home with you, it should be an absolute necessity, that moms are looked after. So that's wonderful that you're doing that. Yeah. Well, do you have anything else, Carley, that you want to add, or?
No, I just, I want to say thank you for having me and allow me to speak about this, because I do think it's really important. And, I think to your listeners, really just remembering that this is such a personal experience, and your decision to birth in home or in hospital or wherever you choose to be really comes with, the responsibility lies with you in terms of choosing where you feel safe and working with your care providers to make the best decision for you.
Yeah, totally. And making sure to advocate for yourself. Okay. Well, if our listeners have more questions for you, how can they reach you? How can they find you? What's the best way to get in contact?
Yeah, so they can find me on Instagram at Dr. Carley Akehurst. I'm currently practicing at Mint Integrative Health at Broadway and Granville in Vancouver. And I also have a Facebook group, Dr. Carley Akehurst ND.
Well, thank you so much for being here, and I know our listeners are going to have lots to take away from this podcast, and thanks for being part of the Mindful Mummies podcast.
Thanks for having me.
Thank you so much for listening to our podcast today. We hope you're finding it comforting and helpful along this crazy journey of parenting. If you like what you're hearing and you enjoy listening to our podcast, we would so appreciate it if you would subscribe and leave a quick review. Also, if you want to find out more about us, you can follow us on Instagram at The Mindful Mummies, or visit our website at themindfulmummies.com. There you'll find all sorts of resources, our blog, and some background information. Thanks again,